Hello, my name is Joanna Schreck. I am currently in the ABA program at Ball State University in the course SPCE 683, session 803 with the instructor Dr. Nicole Weekly. Let's begin with a brief review of the client's profile. JS. He is a 4-year-old boy that has been diagnosed with ASD. He currently goes to school and then has ABA services in the center. He is scheduled for sessions for 4 hours, 5 days a week. He does not take any medication or has any other medical conditions known. Behaviors of concern include aggression, items in mouth, and tantrums. To integrate BACB task list for this session includes C1, create operational definitions of behaviors, C4, measures temporal dimensions of behavior such as duration, latency, interresponse time, and H1, develop intervention goals in observable and measurable terms. The operational definitions for JS are aggression, any actual or attempt instances of hitting self or others with his hands, fists, and or kicking. Items in mouth, any actual instances of having items pass the mouth, lips, and tantrums, any instance of crying, laying on the floor, yelling, and or kicking for more than 5 seconds. For this case study's purpose, I'll be specifically targeting the behavior tantrums. Tantrum is defined as any instance of crying, laying on the floor, yelling, and or kicking for more than 5 seconds. Examples include crying and flopping in response to a demand to transition, screaming and throwing materials on the floor when giving a task demand. Non-examples include crying and laying on the floor in response to injuring himself, or stomping his feet and throwing a body in the gross motor room as part of play. To integrate the BACB task list for this section, this includes G2. Design and evaluate differential reinforcement, for example, DRA, DRO, DRL, DRH, procedures with and without extinction. For possible maintaining contingencies for tantrums, the hypothesized function includes escape and or attention. The antecedent includes identifying precursors, as well as giving visual aids or variable reminders when items will be removed, demands will be placed, or transitions will occur. The consequence includes differential reinforcement of alternative behaviors. The replacement behavior includes functional communication training, asking for a desired item back, asking for a break, or a delayed in gratification skills. The intervention description for attention maintain tantrum is functional communication training and non-contingent attention. For the intervention, a least to most prompt hierarchy will be used. Functional communication training, FCT, includes JS will be prompted to demand, look at me, or say excuse me, or any other appropriate way to get someone's attention. This includes gently tapping their arm or shoulder. Staff should differentially reinforce appropriate responses and getting someone's attention by immediately giving attention to JS and praising him for the appropriate behaviors. Another intervention in place is non-contingent attention. JS will receive praise throughout the session. Throughout the session, JS will be getting praise on the appropriate behaviors observed. For example, if JS is playing with a peer nicely, sharing with peers, listening or following instructions, or any desired behavior, we would like to increase or maintain. The intervention description for escape maintain tantrums include 1. Functional communication training. JS will say, I need a break, or all done. Number 2. Staff will use visuals to prime JS. This includes schedules showing what needs to be completed and what comes next. 3. Using the PREMAC principle. For example, saying, let's brush teeth and then we play animal toys. And 4. Staff will use high probability sequence to build behavior momentum. During structured tables, staff will give 2 to 3 maintained targets. For example, clap hands, do this, 1, 2, 3, then follow with open target when he is still learning or struggling with. The BACB task list associated with selecting an intervention, but not limited to, includes E2, identify the risk to oneself, others, and the profession as a result of engaging in unethical behavior. H2, identify and recommend interventions based on assessment results, scientific evidence, client preference, and contextual fit. For example, expertise required for implementation, cultural variables, environmental resources. H3, select socially valid alternative behaviors to establish or increase when a target behavior is to be decreased. H4, plan for and attempt to mitigate possible unwanted effects when using reinforcement, extinction, and punishment procedures. The interventions mentioned above are evidence-based. I shared some interesting articles. Please feel free to pause and look those articles and enjoy. Thank you.